one, that is pressure sore management. So today we have Sister Anna Daniel Rao with us. She is a BSc nurse. She did her certificate course in palliative nursing with us, and she did her fellowship in palliative nursing from Institute of Palliative Medicine, Calicut, and she has around 10 years of experience in cardiac care ward, and now she is working as a nursing tutor in Sri J. Patel School of Nursing, Karmnisa Danand. So she is a palliative care nurse, and she is one of the faculty last for last since 60 years. So thank you. See you. Thank you to see you again, Anna, and over to you.
Good afternoon, everyone. Thank you very much for that nice introduction. So today we will be saying about the wound management and specifically about the bed sore management. Okay, so let us move directly to the presentation. Okay, ma'am, is it visible?
Yes, ma'am, it is.
Thank you. So why it is so important for us to treat a wound? Right, so if we see the basic meaning of wound, then it will be any injury to the skin. Yeah, and we know the many functions of skin. So whenever there is any injury to skin, naturally the first function is protection, right? So that protective layer is lost. And because of that, it will cause injury to the underlying tissues also. Plus many other functions which are managed by skin, there will be problem in these functions also. And so why it is so important in palliative care? Now we know that whenever there is injury, it will cause patient will not be comfortable, right? So, and in particularly palliative care, if we see, our first and foremost issue is that we should give maximum comfort to our patients. Right, so when there is bed sore, naturally the patient will be in too much of a problem, and we have learned in palliative care about the total pain concept. Right, so we should always see about the assessment part of it, right, and do the assessment in all the four aspects and how patient is suffering when the patient is having pressure sore, and so that we will see today and how to deal with those problems. Fine. So let us first review the basic things about the causes of pressure sore. Right. So we know that the pressure sore is generally caused by three major factors. They are namely pressure, friction, and shear force. Right. So it is said that it takes only 6 hours to start pressure sore, but when it starts, you never know when it will get healed. And especially when our patients are chronically ill, they are very much debilitated, and they most of them will be in bed. Right, so it is so understood that it will take many more days than the common person who is ready to get out of the bed, and the wound healing is also will occur in shorter period of time, right? So but it will not be so in our patients. It is also said that when there is pressure of more than 70 mm of Hg for more than 2 hours, then there will be tissue destruction. Okay? And because of the pressure, it will cause the tissue, underlying tissues will be deprived of the basic things, that is oxygen and nutrition, right? So easily dead tissue will take place, and then all the major problems along with it. Second reason is friction. So anything that will cause friction to our skin, patient is liable to get the bed sore. Right? So it will maybe caused by abrasion of stratum corneum when the skin gets rubbed against any clothing, bedding. So whenever we are changing clothes, right, we many times we have noticed that we have to remove the clothes quite forcefully, or while putting on clothes, right, when the patient is uh, putting her or his hand into the sleeves when we are changing bedding, right? So at that time also problems do occur in this headache. Third is shear force. Now, what is that? It is the force parallel to skin. Okay, so when two surfaces are moving in opposite direction, these things take place. So you can imagine that patient is, we have placed patient in Fowler's position. So patient slips down towards the foot end, right? And we are trying to bring him up, right? Up towards the head and side. So many times we just pull the patient holding the clothes. So that will cause more pressure at when the patient is especially very much weak and thin and skinny. Okay, so we should never forget these three major factors. But along with, there are many other factors. So let us see them. So major risk factors are impaired sensory perception. So this is also quite common in our patients when patient is, say for example, unconsciousness is there, or patient is having diabetes mellitus and patient is not able to feel anything, right? So many things will be there. Second is physical mobility. From long period of time, patient is in the bed only. Patient is not able to move himself, not able to change the sides, right? So problem. Altered level of consciousness. Patient is not at all in conscious state, and patient is not able to complain to you, right? Then uh, this is incontinence, right? It can be fecal also, it can be urinary also. So patient is always, skin is always remaining moist. So that type of skin is also very easily damaged. Altered mental status, including delirium and dementia. Patient is not able to recall things, not able to uh, tell anything about what is happening, and many more things. Patient is not able to eat, right? In such states, many things happen. So patient will have malnourishment when there is no nutrition orally or through NG feeding. Then naturally tissues are not going to survive for long. Dehydration, right? So in that case also easily injury will take place. When there is lot of fluid collection, edema, right? So easily the elasticity structure of skin will take place. Patient is anemic, hypoxia, right? So the patient's tissues are not getting enough of oxygen. And of course, hypotension, when there will be the hypotension case, what will happen? Tissue perfusion will not take place with adequate blood circulation. Right? So these things will cause major problems. Excessive heat. So again, the tissues to survive, they require a lot of water, right? So when the fluid is lost because of the heat, they will be deprived of the fluid. Advanced age. Many old age people, it's very easy. They become bone and skin, and they develop bed sore quite easily. And of course, the chronic medical conditions like diabetes, many times neuropathy will take place, right? Cardiovascular diseases, right? So all these are the risk factors. Whenever patient is having any one of these, we should always remember that we have to do assessment in a proper way so that we can prevent bed sore. And it is always said that whenever patient is getting bed sore, especially when the patient is in our care in hospital, right? So it is nurses irresponsibility that is causing bed sore. always nurses are held responsible for the development of pressure sore. So that should not go, that should not happen. Now let's see about the pathophysiology. Right, so there are various risk factors that are taking place, right? They will act on the area because of any reason which we saw, right? So there will be injury to soft tissue, especially those soft tissues which are over the bony prominences, right? So we know when the patient is in different position, which are the bony prominences. Okay, so that will cause pressure at these areas will exceed the normal capillary pressure. And because of that, there will be occlusion of the blood supply, and tearing of blood supply will also take place. And because of all this, what will happen? The tissues which are supplied by these tiny blood vessels, they will be deprived of the major nutrition and oxygen, and because of that it will cause ischemic necrosis, which we call as pressure sore. Okay, so let's move to the classification. We should know about the classification, because when we then the prevention and the further treatment will also be important. That first, if the patient is in first stage of bed sore, he should not move to second stage and so forth. Okay, so first stage is of erythema. But here what will happen? The skin will be intact. You can see in the adjoining picture, right? So, but you can see the redness. Okay, but it is non-blanchable, right? That means when you press it, it will not change the color. Okay, so it is erythema of localized tissue, usually over bony prominence. Okay, there will be discoloration of skin. When you touch, you may find it warm. Okay, there can be edema also present, and patient also may be, pain may be present. Okay, so when you find such thing in a patient, you should always put him at risk person. Okay, and so naturally it is seen that it involves only the epidermal layer, right? Superficial layer of the skin. Now, second stage. Okay, so you can also call it as partial thickness skin loss. Sometimes there can be blister also. So it can be known as blister stage also. Okay, so there will be loss of dermis here. Okay, there will be open ulcer, as you can see in the picture. Okay, but it will be shallow in nature. Okay, wound can be, color will be red or pink. It may not have slough now. Okay, in this stage. Okay, so epidermis and dermis, both layers are injured. Okay, and either blister or abrasion or ulcer is formed in this. Okay, and it will be naturally painful to the patient. Fine. So then comes third stage. Okay, so it is full thickness skin loss. Here you can see the fat visible, right? In the picture also you can notice it. Both the layers, epidermis and dermis, are lost, and subcutaneous fat may be visible, but it has not reached to bone or tendon. That is not visible. Muscle is also not exposed. Okay, so it is called as full thickness skin. Okay, and third stage. And you know that subcutaneous layer is poorly supplied by the blood, right? So it becomes now difficult for the wound to get healed. Okay, so at what stage the sore is, it is very essential for the treatment. Stage 4 is known as full thickness tissue loss. Okay, so it is the deepest, and it will now extend to muscle, tendon, or even bone will be visible. Okay, so you can see in the adjoining figure how it is shown. Okay. Many times there will be necrosis also. Okay. And the surrounding tissues, there is loss of the supporting tissue is also lost. You can very easily make out in the picture. There is another stage that is known as unstageable. Okay, here you will not be able to find out the depth because there will be so much of slough present. Uh, Necrotic tissues will be present. There might be oozing also. Yes, so you are not able to identify. There will be HR also, right? So because of that, unless you remove the HR with certain techniques, you will not come to know in which stage it is. Sometimes it can be, there may be bigger wound and it can be at all the different parts, it will be showing different stages. That also can happen. And along with that, infection will also take place, right? Secondary infection. And because of the presenting microorganisms and slough and everything, the color may appear different now. Okay, it can appear yellow, it can be green, brown, or even black also. Right? So there will be extensive damage to the local tissues. Okay, many times they require surgical intervention also. Right. So after knowing this stages, why it is important? Because we want to prevent any kind of complications to take place. They should not occur, right? So when there is infection here, what will happen? It will cause inflammation of soft tissues, right, surrounding tissues. So cellulitis will take place, right? If it is in the wound has reached to bone, then bone will get infected. If it is joint, then joint infection will take place. And of course, the microorganisms are very readily go into the circulation and sepsis can also take place. Okay, so our aim is that patient should never develop any kind of complications, right? And prevention is always better than cure, right? So our foremost uh, care should be aimed on these two things. First is relieving pressure and prevention of complications. So what shall we do in our palliative care patients? How to take care of the skin, okay, and the pressure points? What will you do? So first, we will require to do assessment, right? And through assessment, find out what four major problems are there under four major headings, right? Namely, physical, psychological, social, and spiritual. Right. So it is not only the assessment of the bed sore. These things are also important to be seen. Okay. So first thing is care of skin. Okay. So in that, what will you do? You will take care of the patient's hygiene. Secondly, you will see that the patient's position is changed every 2 hourly. When you are doing bedding, you will see that patient is always put on wrinkle-free bed linen. Yeah, because during changing of the position, many times patient may be moving, right? So in such cases, what happens? Bed linen will be wrinkled and patient will be sleeping on that. Many times we put Macintosh for the protection of the bed linen, but wrinkles do occur in them also, right? So and it causes lot of uncomfort to the patient. So always see to it that patient is given provided uh, wrinkle-free bed. Avoiding shear and friction whenever we are moving the patient, when we are offering bedpan or urinal to the patient, right? These things should be observed always. Regular inspection of the pressure points. So unless we do inspection, we will not able to come to know about the stages, right? And whether the whatever steps we are taking, for healing, whether it is properly treatment is going on in proper direction or not, we will not be able to come to know. So regular assessment and documentation, right? These things are must. So if we talk about skin care, then skin is always kept supple and soft, okay, moisturized. So how to do that? When you are giving bed bath, immediately after that apply some moisturizer. Okay. Now most often it happens that patients are economically weaker section. Okay. It is not always that, but most of the patients we many times find in that way, right? So depending on patient's condition, we will see to it that patient's uh, skin, how to keep it moisture. Okay, so there you can help that select simple things like hair oil, right? Coconut oil is easily available. Any edible oil can be applied over the skin. Okay, so that will help to keep enough moisturizer. Even simple Vaseline also will do. Uh, we have always learned that we should apply talcum powder to prevent that, but it is no situation in case of our palliative care. Okay, so why so? Because mainly when we go on applying the talcum powder, we hardly bother to clean it. Okay, so cleaning is must, right? Otherwise, layer over layer of talcum powder will be there over the tissues. Okay, so that creates more problems, more infection. So to avoid that, we are not going to apply any kind of talcum powder. Instead, use this. You will ask me that how to apply it for summer season. Okay, so as I said, after the bed bath or bathroom bath, whatever is comfortable to the patient, after bed drying the skin, immediately applied. Okay, so in case of the summer season, the amount will be less compared to winter season. Okay, so in that way, we can advise patient also, and we ourselves can also do. Changing of position and physiotherapy, recreational therapy, these things are also very well applied, because that will also help to keep the patient moving, and he will be other aspects are also uh, taken care of, like psychological and social. Okay, so these things are also very important. So these are the pressure points. Okay, so you can see in supine position, where are the pressure points? At the back of the head, right? In the occipital region, right? Under the shoulder blades, elbow, buttocks, and hip. If the patient is in side lying position, which are the ear, right? So ears are also very soft cartilage, okay, and it causes pressure there, and many times you will see chip of the skin. So ears, shoulders, elbow again, hip region, right? Then thigh, then legs, right? In knee joints and heel area, right? So these pressure points always need to be checked. And when the patient is lying down in prone position, you can see the pressure points. So whenever patient is in the bed, every 2 hourly, the position should be changed. Okay, and once during night. No need to change position every 2 hourly during night. During night, when you are going for checking the patient, or patient is getting up for a cup of water like that, so at that time his position can be changed. Okay, and when the patient is in wheelchair or in sitting position, right? So every 15 minutes it should be changed. Many times questions are asked here that how it is possible, right? So we will be applying the pads or supporting some cloth or will be there, or some cushion will be there in this region, right? So either you can lift the patient, or if the patient is able to change position himself, then he should move, right? So it should not happen that patient is continuously in the same position for hours together. Okay, so now after knowing the pressure points, let us see other points of skin care. Right, so we should also do gentle massage. Uh, Too much of massaging over the pressure points are not advised, okay, because it will cause more tissue damage rather than doing good. Okay, and of course, no pressure massage on the pressure sore also. Right? So that should be remembered. Then exercise. Right? So passive stretching exercise of each joint. Okay? 10 times at a time. Okay? So 10 times moving of elbow, 10 times of wrist joint, right? And at least twice a day. Okay? If the patient is not able to do himself, we should do. Okay? So it can be active stretching, it can be passive stretching. It will also help in other ways, right? Like it will also prevent atrophy of muscles and contracture of joints, okay, and it will also prevent knee vein thrombosis when patient is in bed for long period of time. Positioning of pillows is also important, right? But it is not always that only pillows will help us. Many times patient may not be having those many pillows in his house, so you can advise that they can put soft cloth in between the joints. Okay, like a patient is, say for example, patient is in lying down position in side lying. Okay, so if you, it may not be possible to put pillow between two knees. Okay, instead you can place soft cloth between two knees and the ankle between two ankles. Right? So place the patient limbs in such a way that there is no pressure. So padding of bony prominences in this way we can do. These beds are of course available in the hospital, and nowadays many NGOs also have come up. They also provide them at cheaper rates at home, especially the air mattress, right? So that can be advised that they can have it at home. It is all, so we should also know about the resources from where they are available, right? So but of course air mattress or water mattress is not the final solution. Continuing of care, continuing of nursing care, and our vigilant observation is very important. Okay? So along with the mattress, this also should be done. Okay? Care must continue. Uh, Particularly uh, pressure sore care, if we give proper treatment, then most of the pressure sores heal. But many times in palliative care, they are at different regions or at a time, and plus large wounds are seen on the body. Okay, so healing, uh, how it will take place, it will depend on many factors. So patient's general health and diet, and of course our preventing measures, right? How we relieve the pressure, and last point will be careful cleaning and dressing. Okay, so all 3 points should be taken care of. So how to go about it? If we talk about the cleaning part first, then how to clean it? So in palliative care, we don't use any betadine or hydrogen peroxide. Okay? Always wound cleaning is done with the help of normal saline. Okay? And normal saline, many times it happens that patient is not able to buy even the pints of normal saline. So how to make it at home? We should know. Okay, so that should be taught to the patient also and the caretaker also. Caretakers teaching is very, very important because always nurses will not be there to look at the patient. Okay, ultimately, patient will be at home. Okay, and we also have to think about the resources for the patient. Okay, so it should not happen that all the resources at home are consumed after one person, right? Because there are other mouths to feed on also at the family side. Okay, so remove dead tissues and scab, but take care that you don't remove freshly appearing normal tissues. Okay, so that any granulation tissue should not be harmed while we are cleaning the wound. And teach the same points to the patient's caretaker also. Okay, and how to go about it? Because once you apply the dressing, what will happen, it will, all the oozing, it will be absorbed in the dressing, and next day when it is to be done, it will be all dried up. And when you are trying to remove the dressing, old dressing, at that time patient will have lot of pain, and along with the pus and damaged tissues, it can harm to freshly granulation tissues also, right? So always moist the dressing. You can also ask patient to take good bath. Okay, so that will help to clear all the slough and necrotic tissues. It will also reduce pain, because when you are trying to remove the dry dressing at that time, along with the damage to tissues, patient will have lot of pain also, and that patient will remember that this pain had occurred, right? So psychological impact is also there when you do next dressing. Okay? And extra dose of painkiller drug can also be given, or you can keep the time of dressing in such a way that it comes after 30 minutes of your analgesic drug schedule. See, either of these two you can do. Uh, then about the nutrition. So if the patient is taking good healthy diet, right, containing all the nutrients, it will be easier to heal the sore. Okay, so we should always see to it that patient takes extra protein and vitamins in his diet. If the patient is having Ryle's tube, then what to do, that we have to teach them. And always give advice in such a way that the diet will contain, the menu will contain local resources. Okay, all the local material should be included in the diet. So that will give less pressure over the economic situation of the patient. Okay. Vitamins also are very, very important. Micronutrients are also very important for wound healing. Okay, so vitamin C and vitamin A is also very good, right? And zinc is also good for wound healing. So we should advise patient in that. Adequate hydration also need to be maintained, right? So minimum of 2 to 3 liters of fluids per day, unless fluid restriction is there in case of, for example, patient is having any heart disease, right? Failure heart. So such things can have restrictions. So we have to find out beforehand. Lifestyle changes are required in many patients, like smoking, right? Because smoking, what it harms the blood vessels, it narrows the blood vessels. Okay, so adequate supply of blood is not there. So that should be taken care of. Alcohol also, right? Exercise. So daily exercise, how to do? We have already seen stretching of the part. Control of incontinence, how to go about it. So for that you have to use appropriate measures. If a patient needs catheterization, then you can do so, right? If patient needs diaper, then we can place him in diaper, right? Many cannot afford diapers, so in that again you can advise them to use and home the clothes, right? Padded clothes can be used, okay, which can be again washed and sun dried, and again they can be reused. So that kind of health education we can give to caretaker. If there is secondary infection, then antibiotics may be required. Right? So we should explain about the medicines, regular intake, right? And along with the diet they have to take. So that also need to be explained. So education of caregiver is must in all these areas. If in case of surgical repair, then what to do? Okay, then we know the responsibility patient will be in the hospital. Right? So our responsibility will be during pre-operative care and post-operative care, whether it is tissue flap or skin grafting, whatever. Right? It can be plastic surgery. Right? So our regular uh, pre-operative and post-operative care in that case. Other treatment options are hyperbaric oxygen, okay, mainly given for the tissues which are starved of oxygen, when the tissues are not enoughly getting the oxygen. Okay, so patient will be, the area will be supplied by high pressure oxygen tent. Okay, so that is used. Then topical use of human growth factors are also beneficial. Right? That will be responsible for new tissue growth. So that also is available. Of course, the economic factors will go along with it. So we have to be cautious. And in that is why they are used in few patients. Okay, now in case pressure sore is having unstageable uh, part, okay, and you can see here HR is there. So what to do if the wound is giving a order, okay, bad order, then we can use matrogel tablet. We can keep the matrogel, crushed matrogel tablet powder, store in a airtight container, and that can be sprinkled after applying and after cleaning of the wound. Okay, so that will reduce the order part. Uh, in some places, this white vinegar is also used, okay, to remove HR. How to go about it? That mix 1 ml of vinegar with 9 ml of normal saline, and you can dip the gauze in this solution, okay, and then place it over the black part, okay, the necrose part you are seeing here, apply over it. Surrounding area will be as normal care. If you require metrogyl, then you can put so, or many times the simple Vaseline also is used. Okay, so in that way you can do the dressing. Many places, especially in interior places, this technique is used, like papaya leaves are used. Okay, so they can be slightly crushed and applied over the bed sore. Raw papaya is also used, either thin slice if the skin surface is even. Okay, if it is uneven, then again you have to create pulp of it and then apply it over your dressing material, and then place the material over the wound. Okay, directly if you are spreading over the wound, then what will happen? You may cause more pain and discomfort to the patient. So always take it over the material and then place the material over the wound. And aloe vera is also used. Aloe vera, how it is used? You can remove the two skin layers, yeah, and take out the pulp and then apply. It also helps in absorbing all the secretions and all, and helps in the healing process. Okay, so interior areas, these things are also used in home care. So what is our role in prevention and management? Okay, let us summarize these points again. Okay, so assess the client for any risk factors who are uh, going to develop bed sore. Okay, so you have to assess them. Uh, Check the skin condition. What is the condition? At least twice in a day. Okay, and you can check whenever you are changing position, right? So that is a good way. Then inspect each pressure site. Okay, at least give 4 hourly back care or like all the pressure points care. That would be good. Or if it is not available, possible, at least twice in a day should be done. Palpation of the skin for any increased warmth in the area. Okay, because that will give you idea whether patient is developing any bed sore or not. Also assess for any dry skin, okay, whether the skin remains moist. If so, why it remains moist. In summer season, say for example, patient will have lot of perspiration, right? So you have to look for it. Any break in the skin. What is the patient's ability to move? Yeah. What is his circulatory status? Whether patient is having any kind of peripheral vascular disease. Okay. So check that. Check all the peripheral pulses, whether any kind of edema is there or not. Assess patient's neurovascular status. All these things will help you to identify the patients and where we are moving to. Okay. In case of incontinence, how it is. Okay. A patient is put on catheter, but whether there is any leakage, right? So all this is very important. Patient is having any diarrhea, what, right? Many times when you tell patient to use diaper, they will just put the patient in diaper and forget everything. Right? They will not bother to change the diaper. Okay? So when to change, how frequently, all these things we need to tell. And while changing also, what care should be taken, perineal care should be given, right? And the joint should be checked, diaper rashes should not occur, all these points. Otherwise, above the bed sore, patient will have other problems also. Uh, and other health problems if patient is having. And not to forget about the pain management. Okay, so assessment of pain is also essential. Here we can find out from the Braden scale, right? Many of you might be using, and we have to give the score, right? So all the risk factors are given here, okay, and we have to tick mark and write over here, right? Date wise, time wise also you can do. So you have to make the total score, okay, and then you can place the patient, whether patient is at severe risk, high risk, moderate or mild risk. Okay, so in that way you can do assessment easily. So if the patient is having decreased sensory perception, what to do? Assess pressure points for signs of bed sore development and provide pressure redistribution surface. How to do? We just looked at it. Then for incontinence, we just taught that how patient has to go about it. Carer has to take care, right? Then for friction and shear, what to do for prevention of it, what to do when you want to lift the patient, always use draw sheet or bed sheet, right, instead of just dragging the patient. Right? So positioning technique also, when your patient is so thin and skinny that you want to change the position, right? So you can very well use the draw sheet, and with the help of other person you can so that patient doesn't fall off the bed, right? So that care also need to be taken. Okay, so positioning technique we should know, avoid dragging in the bed, right? And use of comfort devices appropriately. Decrease activity and mobility, how make a schedule, right? Turning schedule should be made, and teach caretaker also, so they will remember. Okay, so other thing we have seen, nutrition point of also we have checked. If dietitian is available in your hospital, you can very well take help of the dietitian also. Okay, so they will make menu for the patient, and plus they will give options also, that in breakfast suppose what to take, right? So many options are also available. So that way also it can be helped out. Okay, so evaluate ulcer progress every 4 to 6 hours. Okay, and write down. Okay, evaluation and noting is very important, right? Documentation point of view, and you can take a photograph also. Of course, looking to it that patient's identity is not revealed, and measurement of the wound is also important. And you can of course notify to the surgeon or whoever doctor is taking care of the patient that how is the condition. Okay, and whenever there is surgical intervention is required, in that way also you have to assist. Education again is must. So with this I would like to end my presentation.
Thank you, Anna, for the excellent session. Anybody have any doubts on this, please ask her. Either you can unmute yourself and talk, or you can put your questions in the chat box.
Hello.
Yes.
Ma'am, Braden scale to identify at-risk patient. Braden scale, ma'am, kindly explain once more, ma'am.
Yes. So say for example, patient is sensory, first point is sensory perception, right? So whether patient is able to tell you something, senses are there. Many times, say for example, in diabetes mellitus, patient is having neuropathy, patient may not be able to feel anything, right? So whether it is limited or at what stage it is. Okay, so say slightly limited, then you have to put score as 3, right? Then if in case of moisture, what is the condition of moisture when you are assessing the patient? Patient is always moisture or occasionally moisture, what? Okay, so in that way you can place, say a patient is often moist, you find patient is, it can be because of any reason. Okay, so in that you can place as 2. What is the activity level? Patient can walk occasionally, for example, then you can put here 3, right? Then comes mobility. So how mobile patient is? Patient able to come out of the bed, or patient is bed bound, but he is slightly mobile or completely immobile, where he stands. Okay, so that score you have to put here. Then nutrition, what is the condition of his nutrition level? What is it? So that again you have to place the score, and whether friction and shear is taking place in the patient, whether you find any problem particularly related to that patient. So that score you have to place here, and then do the total of it. Okay, so if the total score here is less than or equal to 9, then it is, you have to grade it. Okay, high risk, what is the score? 10 to 12. Okay, severe risk means it will be less than or equal to 9, high risk 10 to 12, moderate risk, patient will fall between 13 and 14. Okay, and mild, patient is at mild risk. So you can advise patient, for example, patient is falling at mild risk. Then Patient may be able to do movement, but you can say that you can do more movement, move out of the bed for more. But if there is some restriction, say for example, patient by moving, he is finding it very tiring. Sometimes patient may become very idle also by remaining in the bed, and many times it may happen that there is no one, patient is taking help of the walking stick or like that, but he needs support, any presence of somebody in the house, but that is not available. Right, so all the other factors also we need to check, and then put the score here, right? Then only correct assessment will come. Okay, so doing in that way, how to move about, how to improve that score. Okay, so you can bring the patient out of it. So this is how we do scoring by use of Braden scale. Is it okay, clear, or still some doubt? This will change many times, it will change daily. Okay, even during the daytime also it can change. Okay, but identifying the patient at risk is very, very important.
And there is a question.
Yeah.
in the chat.
Yeah, okay, in chat box.
Nice.
No, this, see, in the beginning, when there is HR, like the center which I lastly went, IPM, there they were using this vinegar, and for few days, 3 to 4 days, it takes that the HR will come out. Okay, and then there is no need to apply this vinegar. Okay, it is only for identifying and removing the HR from the wound. Till then, that only it is used. And okay, what we use in India. So sterile gloves, yes, gloves are used, but that will be in hospital case, right? Many times at home, these gloves are not available. But we have to see to it that patient cleans hands nicely and then do the dressing. Okay, so of course we should recommend using of gloves, but many times because of economic condition, it may not be possible. Sterile gauze here also we use in India, and at home what they can do is they can have good, nicely washed and sunlight dried clothes, and they can cut into small pieces as per the size of the wound, and they can steam it at home. We have to teach them how to steam it. Okay, so how to go about it? In a vessel, they can take water, okay, and over it you can place a high stand, okay, with holes in it. Okay, so mesh like structure. So, and over that you have to place the dressing material. Okay, and then you have to steam it for half an hour. So this clothes also, the layer of clothes will also become sterilized, and that can be used for the patient. So very poor patient, we advise in that sense also when they are at home. Because many times what happens, that sterile dressing material becomes quite expensive for the patient. Okay, so that is the answer for that. We can also make use of the Vaseline, isn't it? In I think in Pellium we use Vaseline to remove even HR, right, sister?
Yeah, yes. We used to use white petroleum jelly
White,
for
yes.
removing HR, for applying 3 days, so that black necrotic tissue is soft, so
Soft.
that we can easily remove. So when we remove it, it can easily come out. So we used to use white petroleum jelly or Vaseline. And for gloves, as Anna said, in India, we used to use clean gloves for cleaning the wound. For the surgical wound, we used to use sterile gloves. But otherwise, we used to use clean gloves for doing the dressings. And also, we used the sterile dressings. If it is in the hospital, we used to use the autoclaved sterile things. But if it is in the home, we will steam it, and then they can use it. So before and after, before touching the dressing material, they should wash their hands with soap and water. And after that, or after dressing also, they have to wash their hands. So that important message you should tell the caregivers about that.
And most of the times the dressing, I mean the ointment, you can say, is the white petroleum jelly. With that we use for, because it gives not the betadine and like betadine in ointment or like that we are not using in palliative care. So that is also important.
Okay.
Papaya leaves and raw papaya, we have to slightly crush it and make papaya, so make it soft, place it over the dressing material and then apply on the wound. Yeah, so.
Okay, so I have a question. So Anna ma'am said we are not using hypochlorite solutions like povidone and hydrogen peroxide in palliative care. So what is the reason behind that? Any answers?
Yeah, participants.
So I am waiting for your answers. Please put your answers in the chat box. Any answers? Yeah, Anna ma'am said while taking the session, palliative care, we don't recommend hypochlorite solution like hydrogen peroxide and betadine, povidone iodine solution for cleaning the wound. So what is the reason behind that? That is my question. Is it clear? Okay. Any other answers? We have received only 5 or 6 answers. Okay. Okay, thank you. Thank you for your contributions. As one of you are mentioned that it will destroy the granulation tissues. So, and also you have mentioned about it affect the normal cells. One of you are mentioned about the normals. It will affect the normal cells and kill the normal cells. That all answers are correct. So it will destroy the granulation tissues. That is why we are not recommend to use hydrogen peroxide and betadine for cleaning the wound. Okay. So before moving the case presentation, we are planning to share a small video on prevention of pressure ulcer. So after that, we can move on to the case presentation.
Bed sores are easier to prevent than to treat. Mr. Sanal Kumar, aged 35 years, is bedbound after a recent accident. Anita is his wife and caregiver. He is being visited by nurse Sumi at his home. Good morning, Anita.
Good morning, sister.
Good morning, Sanal. How are you?
Good morning, sister. I'm doing fine.
Good.
Sister, I want to ask you something. I've heard that people who lie long hours on the bed develop bed sores. I change his position 2 to 3 times a day. Is that enough?
That is not enough, Anita. I shall show you the ways to prevent bed sores.
Okay, sister.
It is very important to change the position every 2 hours to ensure proper blood circulation. If patient has been lying on his back for 2 hours, turn him to one side for 2 hours. Remember to put small pillows between the bony points of the knees, elbows and ankles to prevent pressure on the skin. You can also use folded sheets instead of small pillows. Inspect all the pressure points with a torch. This is very important to detect formation of bed sore early. In a bedbound patient lying more on his back, inspect back of the head, shoulders, elbow, sacrum and heel. If a patient is lying more on one side, inspect ear, shoulder, hip, inner sides of knees and ankle. If there is any color change in the skin, avoid pressure and moisture on those areas. Using oil or lubricant, massage the patient's back with both hands in circular motion, stroke upward from buttocks to shoulders. This will help to improve blood circulation, preventing skin dryness and cracking. Turn him on his back after 2 hours. Then let the patient rest in supine position for another 2 hours. Again, turn the patient in other direction and maintain the position for 2 hours. Repeat this cycle and continue perform massaging and inspection. It is good to use airbed or waterbed as supporting devices to prevent bed sore. Do not make the patient lie directly on the airbed or waterbed. Always use a cotton bed sheet over the airbed or waterbed. If wrinkles are present on bed sheets, the skin rubbing over the wrinkled sheets may cause friction leading to bed sore. So, always provide a wrinkle-free bed. In case bed becomes wet, change the sheet as soon as possible. Keep the bed sheet dry always. If there is urinary incontinence, place a urinary catheter. Nails should be kept short. Otherwise, scratching can cause damage to the skin. Never drag or pull on a bedbound patient. If needed, patient can be lifted with the sheets. Healthy diet is important in preventing skin breakdown. Encourage the patient to take protein-rich foods like egg albumin, pulses, and groundnut. Drinking adequate fluids is important to maintain hydration of the skin. Patients using wheelchair should be made to lift their buttocks every 20 minutes. Use cushions for sitting on wheelchair. Inspect shoulder, buttocks, heel and ball of the foot. Hope you have understood everything.
Yes, sister.
Thank you. Hope the video is clear to everyone. So whenever you have seen a patient, bedbound patients, you have to keep it in mind. This is very, very important. The prevention of how to prevent pressure ulcer. You have to tell the caregivers and the patient about the prevention of pressure ulcer. So how to, they don't know how to prevent pressure ulcer. Even they don't know how to change a bed sheet from a bedbound patient. So you have, if possible, you have to demonstrate them. So in front of them, when you show it, they will understand well, and then when they go back to their home, they will follow your instructions. So that is very, very important. So while during the session, Anna was telling about the risk factors, friction, share, that these are all the common things. So you have to tell the preventive techniques to them. So always try to prevent pressure ulcer formation. And also you have to keep it in mind, double SKIN. So whenever you have seen a bedbound patients, you have to keep it in mind, double SKIN. The first S is make sure that your patient is getting proper supporting surface, like air mattress or water mattress or any soft mattress or like that. So, and the second thing S is skin inspection. Or whenever you have changed the patient position, you have to that inspect the bony prominence, especially bony prominence. That is very, very important. If there is any color change there, you can give further pressure on, you can prevent further pressure on that area. So that way we can able to prevent the skin deterioration. That is also important. The third thing is K, keep moving. That is every 2 to 3 hourly, we have to change the patient position. And the next word is I. I is incontinence, control. So if there is a incontinence, urinary or urinary incontinence there, if the patient is willing to put a catheter, you can insert a catheter. So if they are not willing to put a catheter, you can manage with a diaper. So if they are not affordable for buying diaper, they can use their own clothes. But the thing is, whenever there is any wet there, they have to change the sheets as soon as possible. And the last one is N, nutrition. Nutrition, hydration is also very, very important. Even if you have changed every 2 to 3 hourly, and you have given soft mattress, you have given air mattress, even then the patients develop the pressure sore, maybe because of lack of nutrition. So nutrition is also very, very important. So these all things you have to keep it in mind. And also one important message you have to tell the caregivers is, whenever you have recommended you to use air mattress, they might be thinking that if they put the patient use on air mattress, the air mattress will take care of everything. Then they will not change the position. Okay, so it will be affecting the patient. Okay, even if the patient is on air mattress or water mattress, they have to change the position. That is very, very important. That message is also you have to convey the caregivers about that whenever you have recommended for air mattress or water mattress for the patient. Okay, so we can move on to the case presentation. Dinesh Malhotra will be presenting the patient story today. Dinesh?
Yes, ma'am.
Yeah, so over to you.
Okay. May I start?
Yes.
Good evening, ma'am. Good evening to everybody. I am Dinesh Malhotra from Mondai Oswald Hospital as a nursing supervisor and from Ludhiana. And today I am presenting case presentation And my patient name is Mr. X. Age is 56 years. Gender male. Diagnosis SDH subdural hematoma. And presenting complaints of patient is his date of admission is 14th August 2022, and his presenting complaints are fever, drowsy, respiratory distress, weakness, and history of illness is when is fever on and off and drowsy, and personal history of roadside accident on 15th April 2022, and history of SAH subacute hemorrhage, and history of 4th degree of bed sore on sacral region, and history of debridement of bed sore on 16th July 2022, and family history, no family history of seizure. And in examination, physical examination is height 170 centimeter and weight is 68 kg, thin built and undernourished, afebrile, heart rate is 120 per minute, respiration is 30 per minute, and BP is 130 per 80, SpO2 is 96. General examination is patient is semi-conscious, disoriented, skin में आ गया उसका Braden score 7/23, high risk था, CVS sinus rhythm, respiratory bilateral air entry present, tracheostomy tube is in situ, abdomen distended, and CNS में GCS 7/15/7, and tracheostomy tube. Pain assessment is 10/2. Treatment and significant investigations. Old history of roadside accident and SAH, debridement of bed sore of 4th degree at ESI hospital on 16th July 2022, post-operative tracheostomy tube. Investigations, NCCT scan of brain by taking slides in posterior fossa and supraatoneal region shows encephalomalacia, gliotic changes, bilateral frontal temporoparietal occipital regions, and cerebral atrophic changes. And routine investigations, there are CBC, RFT, and ABG. And these are his investigations. And in medications, antibiotics, going on multivitamins, antacids, antipyretics, and bronchodilator. And injection Isohope 40 mg IV 12 hourly, that is antacid. And injection MSET 4 mg IV 12 hourly, that is antiemetic. And injection Molase GB 100 ml IV 12 hourly, that is antipyretic. And injection Levira RTU 500 mg IV 8 hourly, that is anti-epileptic medication. And nebulization with Bulin, that is bronchodilator, and tablet calcium. And injection Safeguard 1.5 gram IV 8 hourly, that is antibiotics. And patient psychosocial aspects. My patient is from Jalandhar. He has 2 children, 1 boy and 1 girl. Patient was labor man, and patient's wife is housewife. Health education for palliative care and sportive management to be given. Son is serving, his duties are also affected. No one else is there as sport for long time. Patient treatment is going from ESI hospital. And main concern is poor nutrition, progression of disease, tracheostomy tube in situ, 4th degree of bed sore, and cannot carry out his daily activities without sport. Poor prognosis explained to relatives. And somebody, 52 years old labor man, was detected with SDH, debridement of bed sore, now on palliative and sportive management, had disease progression, referred from ESI hospital, and current situation of patient is having fever and tachycardia. And discussion points are pain management, bed sore dressing, nutrition build-up, tracheostomy tube care, and family counseling. And thank you, ma'am.
Thank you, Dinesh, for the presentation. Anybody need any more clarification regarding this patient story? Please ask her. So otherwise, we can move on to the discussion points. Anybody? No. So I hope this presentation is clear to everyone. So we can move on to the discussion points. So I would like to ask one question, Dinesh. So where is the patient right now? And who will take care of who is the first primary caregiver of this patient?
Now patient is ma'am expired.
Oh, okay. Okay. Anyway, we can discuss. So if you have seen this type of patient in your settings, how will you manage? This patient is having fourth stage pressure ulcer. Today we have learned about pressure ulcer. So if you have seen this kind of patient in your settings, how will you manage? So what do you, Anna? Anybody?
Yes, participants.
So
Fourth stage.
we would like to hear from you. Please speak. We all nurses, no?
Surgical debridement is also done. That's what is mentioned, right? ESI hospital. Okay, so what to do? Fast. Keep your points, or you can unmute and tell.
When side chains too early, we can do.
Okay. Good evening, ma'am. This is Arjun here. We have to take. Yes.
Hello.
Hello. Yes.
Anji ma'am, side too early side. That's so.
Okay. First is side change. Then one side change and nutritious diet for healing of wound. Regular dressing, nutritional support. Support, ma'am, side change, care of wound, dressing as per physician's order, or we can change dressing.
Kanchan, you can remove your headset and speak.
Okay. Okay, use of air mattress, fine.
Dressing of the wound, ma'am, that is the first step for this patient. Side change, as Sister Dinesh has already told us. Nutritious diet for wound healing, as Anna ma'am told us for the diet. We have to take care as speech, SSKI, and supportive services, inspection of the wound.
Secondary infection should not take place.
Side change
Right?
too early, incontinence.
Right. Patient is also having tracheostomy, right? So tracheostomy dressing is also important. Patient has developed fever. So why patient has developed fever?
And if patient is low, cold swelling also.
Right. And identify the causes, right? Why patient has developed fever. Whether patient has any infection, because patient is also, apart from bed sore, patient is on tracheostomy, right? So that also.
Care of tracheostomy tube, it should not be suctioning of the tube, ma'am.
Patient is able to eat properly or not, whether patient is having NG feeding tube, then patient is getting adequate diet or not, because his height and weight, no, I think there is problem, right? Patient is very thinly built. Okay, suctioning of T-tube, fine. Then what else? Pain management. What is the pain score?
It was 2 out of 10.
2 out of 10.
Dinesh, is that patient was conscious?
No, ma'am, semi-conscious.
Then how did you know? How did you assess pain?
मैम जब आया था तब वो सेमी तब तो ओरिएंटेड था, बाद में वो सेमी कॉन्शियस हो गया था.
Okay, okay, fine. So for a semi-conscious patient, how will you assess pain? Anybody can answer. For a semi-conscious patient, how will you assess pain? So our pain session was over. So right now you can able to answer the question. So for a semi-conscious or an unconscious patient, how will you assess pain?
When we change the posture of the patient, judge the.
Kanchan, your voice was breaking. Can you please type it in the chat box, Kanchan? You are not clear. Okay. Nancy Joseph said Wong Baker face pains assessment scale. Okay. Any other answers? Srilada, any answers? This is very bad. We are nurses. We don't know how to assess pain for a semi-conscious patient. That is shame. Please answer. Okay. Facial expression, very good while moving. So, thank you for the contributions. So you are correct. So while we change the position, we need to, for a bed-bound patients, we need to change the position, right? For preventing pressure ulcer. So this patient is already on 4th stage pressure ulcer, but we need to prevent further erosion. Okay, so we need to prevent further pressure sore formation. So whenever we try to change the patient position. So we can see that facial expression. We see their facial expression. So and they will produce some sounds also. So that means they have some pain. So if you have seen these kind of expressions, so you can tell your doctor and give some analgesics before that, before moving that position, before turning the patients or before doing any procedures. So you can see. So sometimes that some patients can tear because of pain, they might be tearing. So that kind of things you can see it, and then you can give some analgesics for that. Okay. So that way we can able to assess pain for a semi-conscious or unconscious patient. So very good. Then any other things you want to discuss? So we were discussing about pain assessment. Of how to assess the pain and all. We all learned what are the types of pains the patients might have. So you have to assess those things if they are able to respond your questions. And also we were discussing about the pressure sore that management. So whenever you have that think about the management part, you have to think about the health status of the patients. If the patient is in end of life care situation, you don't do any curative treatment for that patient. Okay, maybe if the patient is on in a gasping stage, so that time you don't do the that necrotic tissue removing, and there is no role. That time you have to think about the symptom management. You can do the cleaning and dressings. You have to think about the other symptoms and control their symptoms. Make the patients comfortable as much as you can. And but on the other side, if the patient if the patient's health status is okay, his curative possibilities is there, then you can think about the curative management. For example, this is a fourth stage pressure ulcer. You can include a surgeon in that patient care and take a surgeon's opinion. If the patient's health condition is okay, you can think about the skin grafting procedures. So if there is okay, then you can try to do it. So that way we can able to manage the fourth stage pressure ulcer. Okay. And another thing is on we have always tried to prevent a further the pressure sore formation also, so that we also think about that. So whenever possible, you have to turn the patient, and also if the patient is in end of life care situations, try to about too many that they too many if you want to give some medications in one time, so try to do along with that. So whenever you can give the medications, after that then you can turn the patients, so that way we can able to manage. That is about the pressure sore prevention and pressure sore management for an end of life care patient. For a curative possible patients, you always think about the curative management. Okay. And also this patient is having a tracheostomy too. So we have a session on ostomy care, so that day we can discuss more about that. But even if the patient is on tracheostomy too, you have to clean the inner tube always. So every 2 to 4 hours we need to change the we have to remove the inner tube and clean it and return back the tube, because if there is a outer tube is alone, there is a chance of blockage of outer tube. So you have to remove the inner tube and clean the inner tube 2 to 4 hours, and you have to train the caregivers too. Okay, so if it is in the patient, if the patient is in the home, you can train the caregivers. If the patient is conscious, they can use mirror and remove the inner tube and clean it. Okay, you can train the patient for that also. But here is a bedbound patients, nurses can do the tracheostomy tube changing and outer tube tie changing and all. So we don't remove the outer tube. So we used to remove the inner tube and clean the tube, and you can able to change the tie also, and you can train the caregivers also. If you are if the patient is in home, you can train the caregivers too, how to remove the inner tube and how to clean it, how to rebatch that inner tube. That all things you can train the caregivers. So and also nutrition. So in end of life care patients, the patient is no need the good nutritional support, but if the patient is health condition is okay, you can think about the nutritional support also. Here bed sore, if there is a lack of nutrition there is a chance of pressure sore formation. So you always think about that also. Nutrition and hydration is also very much important for that healing pressure ulcer and other things. So that also you have to keep it in mind. So anyway, this patient is no more, but if you have seen this kind of patients in your settings, always keep it in mind, all those points. and treat the patient and family as well. So, and don't forget to care the caregivers. You have to think about the caregivers' distress also. So this is the bedbound patients. They have usually they will take care of all the things. So they usually in the home, the house, whenever I have a lot of experience. If you have asked one question to the caregivers, how will you manage all those things? Then they will start crying. So because nobody is there to listen their problems. So always try to listen their problems also. So we usually inspect the caregivers. You should do like that. You should do like this. So after that, when we visit the next time, they don't do. They will not do like you advised. We start anxious and angry and all. So why are you doing not so as I advised? So I gave a lot of advice. You don't do anything. So that this is not good. That kind of things we used to do, tell the caregivers. But always you have to think about the patients, the caregiver sides also. So here you have to, the psychosocial issues is also there. Their loved ones is going to leave their family. So that is also affecting them emotionally. So you have to think their part also. So try to try to care the 4 aspects: physical, emotional, social, and spiritual care always. Okay. Thank you. Any other points you want to discuss? Anna, any points you want to add?
I think everything was dealt with. Family counseling, as Madam said, is also very, very important, because we are relatives are always on the receiving side, right? From the healthcare professional also, when we are giving health teaching, and also they have to face the brunt from the patient, right? Because patient generally becomes very irritated, and they not only physically, many times mental abuse of relatives is also there. So both the ways, for the patient also and relatives also, we have to see to it, find out the reasons and try to listen. We should be good listeners, so that gives them more support. And home visiting is also very, very important whenever it is possible, and the areas where it is permitted and all things, of course, we have to see, because patients always want to stay at home. So home visits are essential. Somebody was asking about the oxygen thing. So it may be given, high pressured oxygen inhalation, or it can be given at the topical level also. Okay, so especially in diabetes, ulcers and all, it is used. Many other indications are also there for hyperbaric oxygen therapy. So that is used.
And also you can use negative pressure wound therapy also. Negative pressure wound therapy for managing pressure ulcer. So we can wind up the session. Can we, Anna?
Yes, yes.
Yeah, okay. Thank you, Anna, for the wonderful session. So we have learned a lot. Thank you, Dinesh, for presenting a patient story. Sad to hear the patient is no more. Anyway, we will discuss. We can discuss it. So anyway, thank you all for joining in for today's session. Thank you for your contributions. We will see you next time. Thank you once again, Anna. Thank you.
Thank you, ma'am. Thank you.
See you.